It's very important to prevent pregnancy while you're getting treatment for cancer, especially if you're having chemotherapy or radiation. Some of the agents that we use today are actually tetragenic and have effects on children. So those agents have usually black box warning, and the provider or nurse usually sits down with you and actually goes over with you why it's so important not to get pregnant while you're on these agents, and ensure that we register and check and pregnancy tests in between treatment cycles, and that we register with the actual company who has the drug to make sure that they're monitoring you all the way throughout your therapy. They also ensure that you have more than one form of birth control that you're using.
In the old days, we used to have our breast patients get pregnant a lot during therapy. During like their second trimester, they would get pregnant because they wanted their life to go on. And so we don't have to deal with that quite so much, and we can talk about it before that happens and maybe delay it just a little bit.
It's much easier to preserve fertility in male patients, although they have their obstacles as well. So they don't have time as the enemy, such as women do, but they have surgical issues sometimes that get in their way. So men with prostate cancer or young men with testicular cancer can have great detrimental effects on their fertility from their treatments and their surgeries. So it's important to ask your provider what those effects may be and how permanent they may be. Sometimes men can actually have their fertility returned to them after 5 years. So time is much better for men than it is women. So for the young adult cancer population, you really have to broach the subject with sensitivity. So in my practice, I found that young men have a very difficult time talking about their fertility status, actually sexual intercourse, any of those topics. And it's really important that you get them away from their mothers and talk to them privately, because oftentimes, their mom is their person that's taking them to their appointments, such as, treatment for testicular cancer. And so you really need to seek out some privacy with these patients and be able to talk to them about, protecting their partners that they're having intercourse with, and also ensure that, before they start treatment, that they are able to do some sperm banking for men. For young women, some young women, it's been their dream to be a mother their whole life, and this could be the scariest topic you ever broach with them. So you need to be very sensitive to their wants and desires and their dreams. But you need to be very factual about what risks and benefits there are to their treatment and their fertility.